So what we focused on for this educational symposium earlier in the meeting was focus on the practical implementation of gene therapy. So we now have 3 products approved, 2 for hemophilia B, 1 for hemophilia A. And actually at this meeting, there's a second AAV gene therapy for hemophilia A that the pivotal data is being presented. So maybe a year from now, we might have, 2 options for Hem A in addition to the 2 for Hem B. But the focus on practical implementation is we have found that it's been challenging to get patients to move on or move forward with receiving gene therapy in the commercial setting. Some of that is helping people understand, the patient selection process, who's eligible. But then even what we talked about at the educational symposium is not just eligibility, as far as, age, whether you have neutralizing antibodies, liver health, but looking past that to the suitability of going through the process of gene therapy. So now we're looking at parameters such as their ability to comply with the follow-up, trying to ensure that they don't have any risk factors that would make receiving immunosuppression, more of a risk for certain individuals, and also trying to look at what are the patient characteristics of who would be likely to benefit most from gene therapy. And then the next step beyond that sort of patient selection process is what are the institutional challenges of being ready to actually deliver gene therapy. And I was surprised even in my own clinical setting that some of the institutional hurdles we had to go through are different than what we had to set up the clinical trial program. And so I believe a lot of centers are now just sort of working through those processes. What is interesting is I don't believe that the costs of this product is really the primary deterrent. If you look at cost effectiveness analysis of the gene therapies, gene therapy is dominant over every other therapeutic intervention, particularly over time. And so I believe the payers, whether it's commercial payers, state payers, etc., I think they understand that and they realize it's good for patients, and actually over the long haul, it's beneficial for them from a cost perspective. So I don't think the absolute cost is really the big deterrent. I think we're still dealing with education of the treaters, trying to overcome some hesitancy on the patients. Having more data is obviously beneficial for that. And then these institutional hurdles. So that was the focus of the symposium, and we got good questions. And I think hopefully we provided some food for thought of how we can help other centers see that they can actually overcome these challenges and offer this for their patients.